Welcome, everyone, and good morning, good afternoon, and good evening, wherever you are dialing in from around the globe. And welcome to our CIRA, Center for Interdisciplinary Research on AIDS, and Yale Institute for Global Health Early Career Scientist panel titled Crafting the NIH Specific Aims Page. My name is Jeff Wickersham, and I am one of the hosts for today's webinar. Today's webinar is organized by CIRA and by YIGH in collaboration with the Yale Institute for Global Health. A little bit of introduction before we get started today. Today's webinar is being recorded. Links to our recording, as well as materials like slides, handouts, and an infographic will be emailed to our registered attendees following our event. Today's agenda will include a welcome and introduction, our presentations from our esteemed speakers, followed by a question and answer session and discussion on following the presentations today. We will then complete our panel with a closing session and an announcement of forthcoming events from CIRA and YIGH. For our question and answer session, we will be using questions you submitted prior to our event, as well as questions brought up during the Q&A and discussion section. At the end of our session, please be on the lookout prior to closing your Zoom window for an evaluation of today's webinar. You'll be able to provide suggestions on topics and suggest speakers for future events and activities. Throughout this webinar, please feel free to submit questions or comments using the Q&A feature. We are delighted to host our esteemed speakers today. Their full bios are available in the event flyer, as well as the link which is posted in the chat window. Our first speaker today will be Dr. Amy Justice, the Peter N. Herbert Professor of Internal Medicine and Professor of Public Health in Health Policy. Dr. Justice is a clinical epidemiologist who has developed multiple large national cohorts based on data from the Veteran Affairs Healthcare System, electronic medical records, enhanced with the National Death Index and CMS data, patient-completed surveys, DNA, tissue repositories, and stored pathology samples. Dr. Justice has 2 decades of experience in the processes required to clean, validate, and standardize raw EMR data, and in its analysis using standard statistical methods, machine learning techniques, and cross-cohort validations. Dr. Justice brings extensive experience in NIH funding from institutes and centers such as NIAAA, NIDA, the National Institute on Drug Abuse, NCI, National Cancer Institute, NIA, National Institute on Aging, as well as NIAID, National Institute on Allergy and Infectious Diseases. Our second speaker today will be Dr. Nicola Hawley. Dr. Hawley is Associate Professor of Epidemiology in the Department of Chronic Disease Epi at Yale School of Public Health. Dr. Hawley is an expert in the etiology and prevention of obesity-related chronic disease in resource-poor, low-income settings. Dr. Hawley's research focuses predominantly on Pacific Islander populations, although she has ongoing collaborations in South Africa, Uganda, Honduras, China, Colombia, and the United States. Dr. Hawley brings extensive expertise in funding from the National Institute of Diabetes and Digestive and Kidney Diseases, NICHD, NHLBI, the National Institute on Nursing Research, as well as Fogarty International Center, or FIC. I'll now turn over to our first speaker, Dr. Amy Justice, for her presentation. Dr. Justice, welcome.
Thank you. Let's get this into... So before I get into the individual comments, one of the things that I would like to emphasize to everyone is that we're in a landscape where things are changing pretty rapidly. So while we may give you specific examples and specific instructions, I'm going to try to keep most of the comments a bit more general because it's going to be very important that each of you, as you begin to craft your application, read very carefully whatever the requirements are at the time, because as I've said, those are changing rapidly. And when Nikki gives her talk, she's going to talk about how the review process has recently changed. And you need to be very aware of that as you're writing your applications. So I'm going to emphasize knowing your audience, because there is no way that you can communicate everything that you might want to communicate about your application in the 12 pages that NIH allows on many of these grant applications. So you really need to know what you can take for granted in the audience and what you really need to spell out and clarify. And the only way to do that is to learn everything you possibly can about who is going to be reviewing this application. Communication is absolutely the key, and the key to communication is knowing your audience. So the overview of NIH reviews, so very simply, are you submit the grants, they're assigned to a study section by the scientific review group at for the Center at Scientific Review, or CSR, which is largely based on your abstract and specific aims, but you can specify an institute that you would prefer to be the institute reviewing. Study sections that review your grant may be ad hoc or standing, and they have very different dynamics. Standing study sections meet regularly. These people know each other. They've reviewed together for a long time. A lot more things go unstated. Whereas when it's an ad hoc section, people don't know each other. And so there's a really different dynamic in the way the review occurs. Standing study section rosters are available online. And while a few of the people are going to change from one review to the next, the majority of the people will stay the same. So you can really get a flavor of who these people are. What's their training? Where do they sit? What might they be interested in? Those are all things that are very relevant as you're writing your application. Also, once you have been reviewed, you will get a roster of the people who actually served on the review section for your grant. And if you're revising and resubmitting, that again can be very, very informative in terms of preparing your application. 3 reviewers are assigned to each grant. The review criteria will be gone over by Nikki, but that's also a very important piece. You want to make their jobs as easy as possible. So once you know the review criteria, you want to very specifically and in a very flagged way address the review criteria in your application so that the reviewers, if they like it, can basically read what you said in your application as they're giving their summary. The primary reviewer does a full presentation. The secondary and tertiary reviewers simply add anything that they think is in contrast or something that they really want to emphasize. So the primary reviewer is key. If the primary reviewer doesn't like your grant, you're probably not going to get funded that round, no matter what anybody else says. So it is very important that you communicate extremely clearly to a wide audience. And then all study section members vote who are not in conflict. So everybody gives you a score who is not in conflict. And most of those people are going to be scoring you based on what the reviewers have said and perhaps a quick read of your abstract and specific aims. They will not have read the entire application almost uniformly. I mean, it's exceptional for people who weren't assigned an application to actually read it. So that points out how critically important things like your title, your abstract, and your specific aims are. If you don't hook people with that, you're not going to get funded. So much is, as I just said, much is determined based on the abstract and specific aims. These need to be incredibly polished. You need to get lots and lots of people to read and give you feedback. Anything that isn't clear to people needs to be clarified. And again, you want to pick the people who are reviewing the abstract to be people who might be aware of the kind of culture that you're applying to, the sorts of backgrounds that people have. If you're writing a basic science application, you don't want people like me to read it. You want people who are basic scientists. But conversely, if you're writing a population-based study or an epidemiologic study, you don't really want basic scientists to read it. You want people with more of your background to read it because they're the ones who are likely to be assigned to it. Now, the only exception is when you're writing an application that has a bit of all of that in it, then you really need to get a broader audience to read it. You need to make sure the basic scientists understand what you're doing epidemiologically, and the epidemiologists understand what you're doing with your biomarkers. So that makes it even more challenging. Certain expectations, however, are ubiquitous. You need to have perfect grammar and spelling. I can't tell you how many times I've heard reviewers comment, well, there were 10 misspelled words and the grammar was terrible. That grant is not going to be funded. I don't care how good it is. People are immediately shut down by that. Avoid too many abbreviations. It may make the writing easier for you and allow you to cram more in, but reviewers hate abbreviations, especially a load of them. You might even consider having a little sort of guide to the abbreviations you do use at the beginning of your application. While they say you can have up to 4 aims, typically people have 3 aims. So if you don't have a really good reason to have 4, I wouldn't do 4. Many reviewers expect hypotheses to be listed under the aims. Now, that isn't a requirement, but again, it is often an expectation. And this is one of those examples of where you need to understand the culture of the people that you're speaking to. You also need to make the potential impact absolutely crystal clear. That needs to be summarized at the end of your specific aims, but you need to really convince people that if your application is successful, it will have the impact that you're claiming. So clear communication is essential. You can't cover all aspects, but this depends on the reviewer, so you need to do everything you can to understand who these people are. So who serves on a study section? Non-intramural scientists with deep expertise in, quote, relevant domains. And what are relevant domains is determined by the scientific review officers, right? So you need to make those domains pretty clear in what you're putting in, and maybe even in the cover letter that you can submit, so that the scientific review officer picks the right group, hopefully. These scientists can be recommended by scientific societies, authors of recent publications, speakers, having been speakers at scientific meetings. They can be recommended by current and former review members, and frequently are, and nominations from professional societies and university deans. The most common thing is that folks who are on the study section make recommendations to the scientific review officer for who should be invited. And often people who are asked to stand in occasionally as a guest reviewer because of their particular expertise, if they are well received, will be asked to then join the study section. I can't emphasize enough that if you get an opportunity to serve on a study section, take it. It's an incredibly useful experience in terms of understanding how you should write your grants. It's also a way of networking. And these are people who could potentially write letters of support for your promotion and tenure. So serving on a study section is a great honor and it's a big time commitment, but it is a great opportunity as well. So you got to know your institute. There are 27 distinct institutes and centers at the NIH. And while they're all governed by the same set of rules, they each interpret those rules really differently. They have their own culture, their values, terminology, particular interests, and emphasis. And the only way you're going to learn about that is to do some research. So I really strongly encourage you do that. So how can you do that? First, study the website and the studies that they highlight there. So go to the Institute's website, look at what stuff they issue press releases about. What stuff do they really emphasize as being incredibly valuable work that they're doing? But then you can also go to NIH Reporter and look at recently funded projects. Now, what you'll find on NIH Reporter is an abstract, a title, and for the public kind of summary. It's not going to give you all the details, but it will give you a flavor at least of what is being emphasized by that institute. And if you're responding to a request for applications, you can talk to the scientific officers that are listed. Always do this if they will let you do it. Sometimes they will instead have a webinar, which you should certainly sign on. But if you have a chance, if you are allowed to actually contact the scientific officer, definitely do it. They can give you a lot of very helpful information. And then finally, you want to talk with colleagues and mentors who have successfully submitted to that institute or served on the study section. Now, if you're going to talk to somebody who's served on a study section, you have to be a little careful. You cannot ask them to tell you about specific members of the study section and what kinds of reviews they do. That's considered verboten. But you can ask them, what's the culture on this section? What sorts of work do they like to see? What are their favorite pet peeves? That kind of thing they're allowed to tell you. But they have to speak in generalities. They cannot give specifics. They're sworn to secrecy about that. But understanding the culture, that's something they definitely can help you with. So here's something that's going to happen to everybody who submits enough grants, because most grants aren't funded. My grant wasn't funded. What do I do now? So only about 15 to 20% of grants are successful. Some that fail to be funded the first submission are subsequently funded. So don't give up hope just because you weren't funded the first round. The secret is to read the tea leaves very carefully. Was your grant discussed? Only about half are discussed. So if you were discussed, you've got a much better chance of being successful on a resubmission than if you weren't even discussed. And let me just say one more thing about that, because I've heard many people say, well, it wasn't discussed, but the criticisms of the reviewers are totally addressable. Remember that if it's not discussed, only the 3 reviewers who were assigned the grant read it and gave comments. You have no guarantee that those same reviewers will be the people who review the next submission. And further, if it wasn't discussed, they gave you a bad score, which means they may have had 6 other complaints as well that they didn't list. And if you resubmit, those will emerge if you respond to the ones that they listed. So being discussed or not is a pretty important talisman. And although it's painful, study the reviewer comments very, very carefully. What I often do when I first get one of these back is I give myself a day or two to kind of come down off the ledge, right? It's hard. You've spent a lot of time and effort. You thought you put in a really wonderful application. Everybody was enthusiastic about it. And then you kind of get a facial of, sorry, no dice. But there is very important information to be gotten there, and you need to force yourself to read through it carefully. Did they feel the study was important but had specific addressable concerns about the methods? So if you were scored and there were general comments that they thought it was a very important study with a lot of promise, but had specific concerns that are addressable, then revising and resubmitting to that particular mechanism makes sense. The trick here is to balance the advantages of having a clear idea of what the reviewers want against the distinct possibility that someone else may review it next time. So that's why it is very important to realize that no matter how well you do, there are certain things you don't control in terms of the revision. Pay attention to your score. And if you're allowed a single page, the other thing to know is that when you revise and resubmit, you're allowed an additional page, which is the response to those initial reviews. So you also want to make that really, really clear and distinct, because they will, the rest of the committee is likely to look at your response to those reviews. So one of the pieces of advice I got early on in my career, and this was actually about submitting a paper, but it's also true for grants, consider it an opening of a dialogue. You know, you're probably not going to get it perfectly right the first time. The more you have back and forth with the institute, with a particular study section, the more you'll understand what they're looking for. Absolutely take advantage of any offers from scientific officers to discuss either before or after the submission. And as colleagues familiar with your targeted institute, read your abstract. So get colleagues who are familiar to read your abstract and specific aims and give you feedback, and encourage them to be honest, not supportive, not necessarily just supportive. I mean, it is important to know what the reviewers are likely to say when you submit. And that's all I have. I wanted to leave lots of time for questions. So over to Nikki. Sharing.
Thank you so much, Dr. Justice. Dr. Hawley, over to you.
Are my slides showing?
Yes.
Perfect. Thank you so much. So I'm gonna move us, I think, into a little bit more of the technicalities of how to actually put a specific aims page together. And in my opinion, at least, what the aims page has to do is answer three specific questions. What is the problem or knowledge gap you're trying to address? What will you do about it? And why you, why now? And so I serve as a standing member of a study section at NIH. And my scientific review officer is always reminding us as reviewers that our job is to assess, should this work be done? And if it should, can it be done? And so those are the questions kind of to keep in mind, I think, as you're writing this specific aims page, because as Amy said, you want to lead with what is in the back of the reviewer's mind. Should this be done? Can it be done? So that is what you have to communicate on that first page. You also want to walk this line of promising big impact with this work, but also in a way that shows that you've considered potential risk, so that you know that there's going to be rigor and reproducibility in this work, which are big emphasis at the NIH right now. You also want it to be skimmable in about 90 seconds. And so, as we heard a second ago, a large amount of the review panel are reading this in real time as the reviewers, the primary reviewers on the grant, are talking about it. You are skimming this specific aims page. And so you've got about 90 seconds to get your point across. And I'll give you some tips and tricks for how you might be able to do that in just a second. And if a reviewer reads just one page of this grant, it's going to be this one. I made this a busy slide for a purpose, because I hope that maybe when you get these slides, this can be something that you print off and keep as kind of a way of checking a list of things. But really, a strong specific aims page contains, and kind of in this order, a hook. So what is the problem? How big is this problem? And why does it matter for us? It then gets more specific into a gap statement, which is the specific unmet need or the research question at hand. And if you're really smart, you're also telling the reviewers, what are the consequences of not doing anything about this? This is kind of optional, and it depends what kind of grant you're writing, and we'll talk about some different grants and how they may be different in their specific aims page in a second. But quite often in an R01 grant, at least, which is a large project grant, you'll see investigators who are a little bit more established say, this is my long-term goal, or the long-term goal of our research group, and this specific project is going to move us towards it in this way. So kind of acknowledgement of the long-term goal versus what this grant is going to do. A central hypothesis, and maybe it's not a hypothesis for a more exploratory grant, like some of the smaller grants that I listed there. Rationale, so why this will move the field and why you're the group to do it. And then you finally get to your specific aims, which is really what you are going to do, how you're going to do it, and what the results of doing that are going to be, and hopefully the impact. You want to communicate very clearly on this page the expected deliverables at the end of this. So what are we going to know, learn, be able to implement as a result of doing this? Some people put innovation in the specific aims page. If there is really something novel about what you're doing, something genuinely new, having it up on that specific aims page is a good idea. And then finally, you see a lot of successful specific aims page have this one-line closer that says, like, this is going to be the impact. It will allow us to either move forward with a new treatment option or position us to know about the next important question in the field. So this is really, I think, one of the questions that came in before the panel was about the anatomy of the specific aims page. And this is really what that specific aims page needs to contain. Crafting your aims, you want to use really strong verbs in the actual specific aims sentences. So you are going to develop, validate, compare, implement, versus explore, describe, which are more descriptive. And they may be appropriate for smaller, more preliminary grants, but really when you're getting to the R01 stage specifically, which are, again, these kind of larger project grants, you want to be strong in the action verbs that you're using in that specific aims page. The aims also need to stand alone. So one of the common pitfalls that we see is that whether or not you can do aim 2 might depend on whether or not you can pull off aim 1. And that's one of the big turnoffs for reviewers, because we're stuck there at study section talking about, okay, well, what happens if they can't do aim 1? They really can't do the other things they've said. So what are we evaluating? So that's a big, big no-no. It's to a degree in your aims, particularly if you're describing something very novel or something that looks like it could be infeasible, providing contingencies for the high risk elements is a good idea. So articulating very, very briefly, you know, if this doesn't work, this is what we're going to do instead. And then a big thing as I'm reviewing grants that I really look for is do the applicant's specific aims map to that central hypothesis and that long-term kind of North Star that they mentioned? Are the methods then lining up with those aims? And it's clear that the data that's collected is actually going to be used. And then do the analyses get you to the questions that you posed in the aims? So really this idea of traceability all the way through the grant and being able to put all of the pieces together. You want to be nice to your reviewers. So these are people just like us who, I mean, I would love to tell you that my desk looks like this when I review grants, but quite often, sometimes I'm reading the specific aims page on my phone or in an airport on the way somewhere. So you want to be really kind to these people who are reviewing your grant and evaluating it. You want this to be very scannable, so use adequate white space. Don't present a page that is so crammed with text that the reader is really close to their computer having to navigate it. Use bold lead-ins, and one of my favorite things to do is make sure that my first sentences in each of the paragraphs, if you only read the bold sentences at the beginning of each paragraph, you could get to the specific aims page with a good idea of why I'm doing what I'm doing. So make sure your most important information is bolded and in that first sentence. You probably want to have 2 or 3 short paragraphs, numbered aims, as Amy said, and I just cannot echo this enough. Minimal acronyms, minimal jargon in the specific aims page. By all means, use them, expand on them in the main text, but the aims page needs to be very, very readable. I probably would only recommend using figures if they're kind of critical for clarifying some kind of logic. And then if there is preliminary data that's pertinent, I think it's sometimes a good idea to put 1 or 2 sentences there, because it reassures the reviewer, hey, this team have done something towards this question before. They know what they're doing. It's not a big risk to give them the opportunity to do this, but really the details of that live in the strategy. The 1 or 2 sentences about preliminary data go on the specific aims page. The NIH review criteria for many, many years were as follows. Significant, and reviewers were required to give an individual score for each of these pieces and then an overall impact score. So significance, innovation, approach, investigators, environment. For K awards, at least, and I know some of you are probably thinking of career development awards, this looks essentially the same right now. It is likely to change in the future. But there has been a big move by the NIH in the last review round towards actually only scoring 2 criteria. So the 2 new criteria, and I will edit this to put it on the slide so that when you share it, everybody can have it. But the 2 new criteria are importance of the research, which essentially combines significance and innovation, and rigor and feasibility, which is essentially the old approach. And what is really important to remember about this now, and a huge shift in the way that we think about grants, is that excellent methods can no longer offset a question that is not considered of high enough significance. So the score that reviewers give you for your importance of the research is the threshold for your overall score. You cannot improve on that significance score in the overall by having this stellar approach. So importance of the research, significance, and innovation is really where you want to be. And you want to make your responsiveness to these criteria unmissable, and even in the specific aims page. So what is the significance and innovation, the burden, the gap, the potential for meaningful change that your work is going to address? How are you going to do that? What are your endpoints? What is the feasibility of doing this? And then I think probably, because now the way that we review investigators in the environment is literally just to say appropriate or not. And so you probably only want to take one line of real estate on your specific aims page to say, you know, we are the right people to do this. We have the expertise. And you can signal that through preliminary data or just saying something about your experience in the field. I mentioned different mechanisms earlier, and I know we've got a diverse audience. Specific aims are really tailored by mechanism. So RO1, the larger project grants, hypothesis-driven, powered endpoints, very clear milestones, probably less risk tolerance among the study section reviewers than there would be for an earlier grant. R21s and RO3s, which are smaller grants, can be feasibility, novelty. This is where more descriptive aims might be appropriate, but really with these grants, we're looking for sharper, smaller, more concrete aims. And then K awards, and I know we had a question about this prior to the panel, integrate training and research. So each aim should very clearly be building some kind of pre-specified competency in the applicant. These are the common pitfalls. So I mentioned earlier, aim dependency. If you cannot do aim 1, aim 2 and 3 cannot be completed. So you want to think about ways to address that. Overreach. So you don't want to present 4 fluffy aims. You want to present 2 or 3 really crisp, well-designed aims. Vague endpoints are a big no-no. So if you say, we're going to assess X or Y without actually saying how you're going to do that, not great. You want to be very clear about what the primary outcome is and your metric for success. Another big pitfall is putting too much jargon and methods on the specific aims page. That detail needs to be in the larger grant, and again, very clear writing, concise writing about methods there. And then Amy mentioned or used the words pet peeve earlier. A big pet peeve on my study section is calling things that have already been done novel. So be really careful in your aims page to be precise about what really is new. And I will say that with the combining of significance and innovation into that new importance of the research metric, there's a little bit less pressure to be excessively enthusiastic about the innovation of your work. The significance is important enough to carry it now, even if something is not as novel as maybe would have been important before. And then finally, just to summarize, I put together this aims page checklist that hopefully might be useful. And these are things that you should be assessing or asking those people who are reading it to assess for you. You know, does this paragraph that you open with make somebody who's not an expert in the field interested, make them care about the problem? That's really important. Is it very clear what the gap you're addressing is? Can the reviewers, again, as Amy said, describe what you're trying to do in 1 or 2 sentences? Because that is the job of the primary reviewer. Make that easy for them. Make it very obvious from the specific aims page. Are you using strong action verbs? Are you naming your endpoints? Are the aims non-dependent? Is the impact claim concrete and credible? And then are there cues for rigor and reproducibility, feasibility? And then finally, would a policymaker or clinician understand why you're doing this work? So hopefully those technicalities are useful, but I'm excited to hear some of the questions from the panel. I'll stop sharing.
Nikki, one thing that I think we probably would both agree on is one of the most common mistakes is trying to write the grant in too short a time. What's really important, especially I would say for CDAs, but for all of these grants, is to give yourself time to have your writing and your thinking mature. And that means sleeping on it. That means getting other people to give you feedback. That means revising. And people who try to write these grants, 2 weeks before the deadline are almost never successful. The other point I would also just make really quickly is that these study sections have a long memory.
They do.
And so if you put in a piece of junk,
Yeah.
and that's the impression,
yeah,
it's going to be really hard to come back from that later on. So you do not want to submit a half-baked proposal.
Yeah, that's a wonderful point.
And that's a common mistake that junior investigators often make. They think, oh, well, I'll get some initial feedback and I can fix it. But if you come across as not being careful, that's a death knell for that particular funding group.
Yeah, agreed.
Thank you so much, Dr. Hawley, for that fantastic overview. Perhaps as we enter the Q&A period of our panel, I'll take a question from one of our viewers that was submitted during the registration phase. Dr. Hawley, maybe this question can go to you first, as one of your slides pointed out, to avoid weak verbs like explore in the specific aims, as this question somewhat relates to that. This viewer wrote, "What's the best way to handle an exploratory aim that depends on results from a primary aim that does not make the proposal look weak?"
Yeah, so actually it's funny that that question came up. We actually just got a grant funded that did exactly this. So we had 3 specific aims that were very concrete, and then we actually called aim 4 an exploratory aim. And we said, if we see XYZ in the first part of this, then we're going to go ahead and just explore what the possible mechanism of action is. We say very clearly, this is exploratory, this is not well powered, but we believe that it doesn't add any more burden to the participants or the project to do this. There's no additional cost, but we believe that this will get us from point A to point B. So I think that in that situation, if you have an exploratory aim, you definitely don't want it to be the first one, because you don't want to say, we're going to explore this, and then if we learn this, we're going to move on. But I think sometimes having either an explicit aim that's labeled an exploratory aim, or a sub-aim under one of your aims that, again, you just say very clearly is exploratory and it has the potential to do this important thing for the next steps of the work.
Yeah, I like that second approach in particular, Nikki. I've recommended that to people because that way it's clear that it's not dependent. I mean,
Yep.
that you can go on to do the other aims and be successful, but that it is a way of enhancing the work if certain results are found.
Terrific. Perhaps the next question I'll take, which was posted in our meeting chat. This question, I'll repost it in the chat for everybody, just in case, so you don't have to scroll up to it. This question comes from Julius, who says, if the specific aims must be independent and the idea is to have at least 3, wouldn't it be possible that I would end up with scattered ideas for each of the specific aims? And wouldn't this mean that I'm proposing something incoherent?
I'll start. That's the challenge of writing a good grant. Typically, what you need to do is think about, okay, there's a particular domain of work that I'm very interested in that's very related, but not dependent. So for example, one might say, I do a lot of predictive modeling. So I might say, I'm going to, take this predictive model, which I've developed in other data, and test it in an outside data set. That might be my first aim. And then my second aim might be, I'm going to take this predictive model and look at its association with inflammatory biomarkers in the data set I've already validated it in, right? As a predictive model. And then my third aim might be, I'm going to take this predictive model and develop a decision support that could be applied in the context of the data that I've already shown that it works in, right? So those are not dependent. I can do any one of those 3 things even if I fail in aim 1 or 2. They don't require that I be successful in the prior aims. They are obviously topically quite related, right? That each is going to enhance my understanding of how useful this index is for various clinical purposes.
Yeah, another good example is if you're if you are trialing an intervention study, for example, an early stage intervention, then maybe aim one is about feasibility and acceptability of doing this, and your endpoints are linked to this. And then maybe aim two is efficacy. So does it actually do what I think it's going to do? And maybe aim three is cost. So it's all linked to the same project. Your goal is to make them highly interrelated, but not interdependent.
Great, thank you so much. We'll go to another question that was posted in our Q&A window. Just for ease, I'll place the question in the main chat room. That question is, how much emphasis would you put on showing that you thought through those contingencies or the what could go wrong part? I.e., we know there is this level of risk in approach X, and if what we propose doesn't work, we can also try Y. And I think, Nikki, you touched on some of that as well.
Yeah, I mean, so this is not something I often do, and I realize I said it in a couple of slides, so maybe overemphasize this point. But I think if you are proposing something particularly novel or something that you know maybe a reviewer is going to question the feasibility of you being able to do, like if I say I'm going to go out and recruit 6,000 families from this place, I want to give the reviewers some kind of idea that I've thought through the risk of doing that, or how I might address feasibility. So you don't want to give a lot of real estate to this, but you want to nod to it. I think if there is a case where something and you've heard from people who've reviewed it, oh, I think maybe the panel is going to get stuck on whether you could really actually do that.
Right. So just as an example, in any kind of intervention study, in recruitment, achieving recruitment goals is everybody knows that's a hard thing to do, right? So you probably would want some sentence about what you'll do if you don't reach your recruitment goals.
Mm-hmm. That's a good example.
But I completely agree with what Nikki said. You only cover it if you know this is going to be something that comes up again and again.
Great. Let's go to another question that has been posted in the chat. This question comes from Stella, who writes, for a K award, do you need to have perfect symmetry between the specific aims and the training aims? I think that means the research aims and the training aims. That is 3 specific aims equals 3 training aims, or can you have some asymmetry between those? For example, 3 specific aims and 2 training aims.
I think to some extent that depends on which institute you're going to and what the culture is for CDAs. And those cultures, in my experience, vary even more than the cultures around R01 applications. Each institute kind of has its own favorite way of doing this. In general, you want your aims to both achieve scientific goals and enhance your education and training and methodologic skill set. So it's not like there should be separate aims. Ideally, they should be one set of aims that speak to both sides of the house, so to speak.
Yeah, I think the most traditional way that I've seen it is to have your aims be the science, the research question, but kind of in the text that often follows the specific aim. So usually you write a bolded specific aim and then some information about the method, the outcome. And in that secondary information there, I want to know what competency you're building that contributes to your training goals.
They shouldn't be thought, you shouldn't think of them separately. You should think of them as a whole. How is our funding you to do this career development application going to enhance your training while developing your science?
Mm-hmm.
Sounds like they need to be harmonized quite well, that they need to.
Well, they're not even harmonized. They're homogenized. They should be, the same thing, but you need to help them understand how, again, I work a lot with big data sets. So getting access to this data set will teach me about how to interpret data from X, Y, and Z, that sort of thing.
All right, let's go to another question in the chat from Drew Cameron. It's the most recent post in the chat if you want to read along. Drew writes, to what extent should foreign justification take up real estate on the aims page? is emphasizing the generalizability of the innovation/scientific question enough? Or is there more advice you can offer on this front given current times? I'm concerned with this for a K01 award I'm proposing in East Africa, but the question stands for our type awards as well.
I'll let Nikki answer. She does more international.
I do. I wish I didn't have to answer this question, and I'm sorry we're even talking about this, because I think almost everybody on this call will appreciate the value of work that happens outside of the US for informing all kinds of things about what happens inside the US. I think in the current moment, I would make an effort to nod towards that. If we're talking about real estate and I was to give a specific if I were to give a specific sentence number, 1 to 2 sentences max. But I do think that in the current climate, it's worth saying like the whole thing that we are reviewing on a study section panel is this going to move the state of the science? And is this going to move the state of the science that is applicable to all? So making a point that what you are planning to do, and in a K award, who you are going to become as a scientist, is going to move the state of the science for all, is a really smart thing to do. So in the current moment, I would give that some real estate. Yeah.
Great. The next question is from Laurel, who writes, do you all have any preliminary insight into what is acceptable now if we have historically done equity-focused and gender-based work? And I think this applies to many of us, myself included. I'll turn it over to our panelists.
So I'll start because I just put in a P60 last year that started with the term equity and was focused on transgender. And when I was asked to revise the application, they asked me to take out, the words that they don't like. So I put in socioeconomically disadvantaged as a way of capturing the concept that different groups have different access to these benefits. And I was told that was acceptable. Now I'm still waiting to hear whether or not we're funded. So, but I think, and honestly, I think we all struggle with this ethically, right? I think it's really important not to give up working on what we think are important populations and improving their health. And clearly NIH funding is a major way of being able to do that. So it's a fine line between taking out certain terms that they find offensive and not doing the science that needs to be done. And I'm not going to pretend to tell people how to make that decision. But one approach, I think, is to emphasize socioeconomics, which is still, I believe, an acceptable thing to emphasize.
Yeah, or rurality or resources or geography. Yeah, I had a really interesting conversation with my program officer. I'm in the process of resubmitting a grant, and as many of you know, I think I work in American Samoa, which is 95% Pacific Islander. And I said, well, should I expand my recruitment criteria to include the other ethnic groups that live there who probably wouldn't even meet eligibility criteria, but do I do this in the current moment? And she advised me not to, and she said keep it to the population that you originally proposed to work in, but give very strong scientific justification for why this group is the focus of this application. Yeah, it's a tough moment. I'm sorry we can't address that better.
Yes, I think we're all in a
But actually, the other thing I will add is in the discussion at study section, this is not coming up. And Amy, I don't know whether you've had experience of this recently, but we are not like at study section having conversations about, oh, we shouldn't score this well because it focuses on equity. So I think back to the beginning of this and knowing your institute and in what ways they're going to advocate for you is particularly important, because those decisions happen either prior to study section or after.
Well, and this gets back to the point I tried to make at the very beginning of the talk, which is that this is such a rapidly changing landscape that you need to understand the specifics when you actually are applying. Right now, the NIH reviews it, and then it goes to DOGE. So the NIH can say, yes, we want to fund this, and DOGE can say, no, we don't want you to fund this.
Yeah.
That may change. And I think DOGE's fine-grained refusals that were happening earlier this year are relenting a bit. And that they're paying a little bit more attention to what NIH is saying about what they want to fund. But it's a two-step process, and the two groups are not really talking to each other very much. Sorry, that's just the reality of the situation for now.
Indeed, there are a lot of unknowns right now. Let me pull a question from the Q&A window. I'm going to bring it over to the primary chat so everybody can read along with it, and then we'll go back to previous questions in the main chat. This one says, can you also comment on the balance between narrative coherence or presenting your story and checking all the boxes, so to speak? I often feel that checking those boxes disrupts the story I'm trying to tell.
I'm not totally clear on what is meant by checking all the boxes. Did we get a little clarification?
I lost who submitted that question, but if the person who asked that is in the chat, please feel free to add your clarification.
It was Cindy Yati.
Okay, thank you.
Can I speak up?
Sure.
Yes, no, I just meant making sure that you are going through all the criteria that are listed in either the request for proposals or anything.
So this is where serving on a study section or a practice review session, I think, is incredibly informative. Reviewers are asked to review anywhere between 4 and 10 grants, sometimes more. Nikki, I don't know how many you've had recently.
9.
9.
Yep.
And we're supposed to go through, if we're primary reviewer, we're supposed to read everything. The amount of time that they can give to any one of these applications is really minimalistic. This is not a creative writing contest. This is really a contest on how clearly you can communicate that this is a grant that should be funded. So I think actually you do have to pay attention to checking off the boxes. And not only that, you need to check off the boxes where they are expected to be checked off. That's another thing that people often omit. The methods section needs to cover feasibility, for example, right? The reviewers are expecting to see information in certain places, and you may have that information someplace else, but if it's not where they're expecting to see it, they may not see it. And they may say this was omitted from the application. So I think you do have to check off the boxes and check them off in the sections they're expected to be checked off in.
Yeah, kind of unpopular opinion here, but I think actually you just hit on the magic of the grants that get funded, is that they are the ones who check all the boxes, and they do so in a very coherent way, in a very readable way. So it's worth working through that struggle to try and find that magic of hitting both.
Thank you for those great responses. I'll go back to the main chat. We have a question from Carrie Hall, who writes, I have a similar question as Drew. Our project was specifically focused on Black women in the postpartum period. For a resubmission, I'm wondering if we can focus on, quote, all women because of what is going on currently.
So my answer, actually, this was an issue in my application. We had Black women as one of the groups that we really wanted to focus on. It was an HIV application. So obviously Black women are very relevant. So we changed it to women. And more than half the women with HIV are Black. So it would be presently possible for us to do that. I just want to quickly say before the time is up, that
Yes.
there are wonderful resources online. If you go onto the NIH website or even just do a search in Google, the AI will bring it up. There's a lot of very helpful talks and presentations through NIH that you can access that way. And I would strongly recommend. I mean, I actually took several of the questions that people had offered, put it into Google to see what the responses were like, and they were very, very useful responses. So just for the future, if people need that.
Yeah. And ask your colleagues with successfully funded grants. I mean, I don't think I've ever said no to a request to share an application, because everybody's goal is to get funding around here. And so find your colleagues who've been successful at this, look at what the structure looks like, find something you like, and then try and model your grants on it. We have wonderful, if you're at Yale, we have wonderful repositories, certainly at the School of Public Health and the School of Medicine. And there are lots of ways of accessing great examples.
I was just going to mention, Nikki, the repository of funded awards, which includes a whole spectrum of P30s, K awards, R mechanism grants, which is a great resource for folks who are writing applications. I'm afraid we are coming to the close here. We only have 3 minutes left. And Dini, my colleague who's in the chat, should we move to our closeout, or do we have time for one more question?
Yeah, I think we can move to the closeout, and I'm just going to show very quickly some upcoming events organized by CIRA and other community. Let me put my slide in full screen. Okay, sorry, I need to pull up this. Oops, sorry. So yeah, so the one upcoming events next week is a global live stream event, 24 hours to save AIDS research. And then there are also a couple of other events at Yale and also organized by the NIH. And we will share the links to these events with information by email. So you can sign up to attend if you are interested. And with that, I would just like to have a quick reminder that we will then as you leave out the Zoom meeting, you will see a very brief evaluation survey. Please share your thoughts, your feedback, your suggestion for upcoming events that we can organize in this topic or HIV related topics. We will appreciate your feedback and suggestions. And thank you so much to our presenter, Dr. Hawley and Dr. Justice, and also Dr. Wickersham for moderating this terrific event. Thank you.
Thank you, everybody, so much.
Thanks, everyone.
Thank you so much, Jeff. So I will close the Zoom meeting.
Thank
Thanks,
you, Dini,
everyone.
very much. Thank you.